So next we have a very, very wonderful presentation by Dr. Satish Pathak sir, who's come all the way from Pune, Kaivalyadhama. We also have an MOU with them. Very, very proud, honored and privileged to say that we have an MOU. And Dr. Satish Pathak sir, he is a general surgeon and a yoga consultant, Yoga Ratna awardee and World PhD Chakra Award he's received. And then he is the director, assistant director of the scientific research department at Kaivalyadhama, and member scientific committee for MD NIY, the Ministry of Ayush, Government of India. The biggest achievement for him, he's had lots of achievements, but the important one I would say, like our Madan Mohan sir, who included yoga into the medical curriculum. Sir has been instrumental in including yoga into all the medical colleges in Maharashtra. So Madan Mohan sir, he is something like you, right? You both are in the same space here now. We are really honored to have both of you here. And conducted so many international workshops, and you are going to enjoy him live here. So without much ado, I am handing over the mic to Satish Pathak sir.
So good afternoon everybody. After a very good inspirational and informative talk of Dr. Venkateshwaran, it's now my responsibility to keep you awake. I hope now you will be reaching the lunch time, so you will be definitely awake, but I will try to make you still more awake. So my topic is, I will start with the prayer as usual. Guru Brahma, Guru Vishnu, Guru Devo Maheshwaraha, Guru Sakshat Parabrahma, Tasmain Sri Gurave Namaha, Tasmain Sri Gurave Namaha. With due respect to Swami Kevalanandji, the organizers, Dr. Bhavanani, Dr. Madan Mohan sir, and all yoga lovers. I have been given very unique topic today, yoga in pre and post-operative conditions. I have been practicing yoga and teaching yoga since 1994, and I am also a surgeon, practicing surgery from 1973 to 2019. So when initially in olden days yoga was not used as a therapy, but last 15-20 years we are using it as a therapy. So we have seen that how much effect is seen in different diseases. As I was practicing surgeon, and I used to see lot of problems with the patient in pre-operative and post-operative period, I thought, why not to use this? And I am using this yoga as a tool to the pre-operative patients and in post-operative period for last about 10-12 years. So this is a topic of choice given by Dr. Bhavanani. So I am very much thankful to the organizers and Dr. Bhavanani for giving me a topic of my liking. Now, as you know, yoga can be practiced by anybody. As yogic science says, yuva vruddhoti vruddhova vyadhito durbalopi va abhyasat siddhim apnoti sarva yogeshwara tandritaha. Means you may be of the age of 10 to 20, 30, 40 till 100. You might be young, you might be senior citizen, senior citizen. You may be healthy, you may not be healthy, you may be having some disease. Anybody can practice yoga. And that is why I ventured to use this yoga tool for the pre-operative patients also. Now, what are the problems faced during pre and post-operative period? Now, usual problems, they are seen with the patients who are going to undergo some major surgery like heart wall surgery or bypass surgery, or second is a cancer surgery, and third is a planned major surgery requiring more than 2 to 3 hours. So, they are under anesthesia for more than 3 to 4 hours. So, these are the patients, they face more problems. Now, if you try to classify the problems, problems can be immediate after diagnosis, preoperative period, intraoperative period, and postoperative period. Now, we will see what are the different problems faced by different type of patients. Now, problems immediately after diagnosis faced by the patient, these are the fear and apprehension due to diagnosis of a dreaded disease. If anybody is diagnosed that you have got a cancer, in my cancer lecture, I write that C-A-N-C-E-R, at the R I superimpose L. So, once patient is diagnosed cancer, what he feels? Cancel, my life is over now. That is the first feeling he gets, he is half dead. Now, such patients, they have got a fear psychosis, apprehension, what will happen? I am still 40 and I have got developed cancer, so what will happen? I will die in another 2-4 years. Then heart surgery. Heart surgery is a major surgery. So, that also patient gets frightened. Then major surgery like removal of any part of the bodies. Suppose somebody's stomach is to be removed, kidney is to be removed, suppose hand is to be removed or leg is to be removed. So, they get frightened. So, these are the major problems, and that is why they go into sad mood or they are depressed. Now, all these things, they activate the sympathetic system. And once sympathetic system is activated, what happens we have seen in the morning lectures. So, I do not go into details of that. Now, problems faced in preoperative period faced by the patient, the preparatory phase for the surgery. Now, once patient is diagnosed that he has got cancer or heart disease, and then he has to undergo major surgery. Now, when he has to undergo major surgery, he has to undergo lot of investigations, blood investigation, then MRI, CT scan, sonography, all that. So, he is under tension, because if the investigations say that you are fit for surgery, you will be operated. If investigations say no, you are not fit for surgery, then your surgery will be postponed. If surgery is postponed, then patient will think that my disease will progress, and if disease progresses, what will happen to me? So, that is another tension for him. So, he is worried about fitness. So, he has to face the stressful situation arising as a patient. He remembers one of my colleagues, he was having same problem. She was operated and he became all right, and 1 month he joined the duties. So no problem, I will be also all right. But by the time he finishes that thought, he remembers another patient who was also his colleague. He was having same problem, he was operated, but he is no more today. So that thought makes him think, what will happen to me? Worried about the outcome of the major surgery, knowing all these things, he thinks, what will happen to me? Whether I will be like patient A who is now working with me after surgery, or like B who has already gone. So where am I? He doesn't know. So he is more worried about the outcome. So he needs a mental and emotional stability which has got direct effect on outcome of the major surgery. The way you think you become. This always matters everywhere. I will tell you one example, willpower. One of my patients was 74-year-old and he was having ulcer in the stomach which was heading towards malignancy, cancer. So we have to remove his whole of the stomach, that is called total gastrectomy. And it is a major surgery, it requires about 2 to 3 hours. So we said we have to operate. He said, yes, I am ready to get operated. But his relatives, they came and fired us. What you are going to operate on this now 75-year-old patient? Let him live whatever small span is remaining. We don't want him to get operated. I said, okay. because unless and until patient gives consent, we cannot operate. So we said, okay. Next day patient told me, sir, I am the patient, my stomach has got ulcer, you are going to operate, you operate it, I am giving you permission. Who are those relatives? They are there because my money is there, they are with me. Once my money is over, they will not talk to me also. So you operate. With the cautious mind and guarded prognosis, I operated that patient in 1989. As usual, 5th, 6th day, because the gastric surgery is very major surgery, he had some problem and he became serious. From 7th day till 13th day, all his relatives, they used to come and bombard on us. We were telling you not to operate. What you have done? He has become serious. Now he will die. We were cross hand and we were praying God. And luckily, on 14th day, he came out of that crisis. And he was discharged on 28th day. And till his age of 95, every year he used to come and bless me. Every year he used to come in that same month, which month we operated, and he used to bless me. Why? The willpower was there. So willpower is very important, and this we can achieve by practicing yoga. That's why I want to emphasize on the willpower. And then all these things had gone, then he thinks, now I have to get operated, so requires finance. In olden days, the expenditure was in few 100,000 rupees, but now it has gone into few 100 lakhs rupees, which a common man cannot afford. So he has to see for the loan, or some friend he will give money, or mediclaim or policy, whatever he has got. So he has to make all those arrangements. Then intraoperative. We have seen all the preoperative problems. Now what are the intraoperative problems? The problems are faced by surgeon and anesthetist, not by the patient. Why? Because he is unconscious. He cannot face the problem. The problems are faced by surgeon and anesthetist. What are they? Anesthetist. Now when we want to operate any patient, we have to make him unconscious, anesthetize him, paralyze him totally. So for that, we give injections like propofol and scoline and pancurinium, which relaxes, paralyzes all the muscles of the body and make him totally blank. Now, when we start operation, before that, we anesthetize the patient. Once we finish the operation, we withdraw, the anesthetist withdraws the drugs which is anesthetizing patient and give antidote like neostigmine. That is called reversal of anesthesia. The patient is put tube into the trachea and he is put on respirator and artificial respiration is given, and then we are operating. Whatever jugglery we want to do, we do that time, because patient is also not able to see what we are doing. Once surgery is over, then he gives antidotes and the reversal occurs. The drugs are washed out slowly, patient comes out of anesthesia. If all organs are functioning properly, whatever drugs were given for giving him anesthesia, they will be washed out, then antidote will act on it and patient will come out of anesthesia. If the organs are not functioning, what will happen? We are given anesthesia, we are operated, patient doesn't come out of anesthesia, because the drugs which are circulating into the body, they are still there, they are not excreted by the kidney. And so what happens, sometimes it has happened, patient's relatives ask, what is the time required for the operation? We say half an hour will be sufficient. And then patient is taken inside, we operate, 1 hour passed, 2 hours passed, 3 hours passed, patient is not coming out. Relatives are all the time asking the in charge OT, what happened, our patient is not coming out. He said only half an hour. Why it has happened? Because the anesthesia was given, patient didn't come out of anesthesia, and myself and anesthetist both are sitting by the side of the bed of the patient and pumping with the bamboo bag, waiting when he will come out of anesthesia. So this is because of the organs not functioning properly. So these problems are faced by the surgeon and anesthetist. Now coming to the post-operative period. These are faced by the patient and also surgeon. Now what are the problems faced by patient? If all the organs are functioning properly, if healthy, the healing of the wound, it will depend upon good functioning of all organs. Happy mind, it will secrete happy endorphins. Just now we have seen in the previous lecture, secretion of dopamine, serotonin, oxytocin, they all help in better healing of the wound. Now good muscle strength will prevent burst abdomen. Have you understood what the meaning of burst abdomen? When we operate, we take an incision of the abdomen like this. Now there are about 6 to 7 layers when we reach to the intestines. So after finishing surgery, we close one by one, layer by layer. So we close the abdomen in 7 layers. And once patient comes out of anesthesia, he is shifted to the ward. And if something happens, there are 2 reasons. Either the cells are not in a good condition, so whatever sutures you have taken to keep this tooth in position, they give way and abdomen opens, scar opens up. That is called burst abdomen. You must be knowing some patient have developed incisional hernia after operation. After a few days of operation, in the scar there is a swelling over, intestines are pouting out. That is called incisional hernia. Why this happens? Because the wound has not healed properly. So this is again depending upon the muscle strength and the cell functioning. Early mobility will be possible, preventing post-operative chest complications like pneumonia. If patient is sleeping non-ambulatory, lying down on the bed for a long time, the lungs, they don't function properly. And then patient develops pneumonia. You might have heard also sometimes in paper also you might have heard the so and so fellow, great person, he was not well and admitted in the hospital for last 2 months, and last 15 days he was recovering. But suddenly he developed pneumonia and he died. Hypostatic pneumonia. Why? Because the lungs are not functioning, because ambulatory, hardly 25% lungs is functioning, remaining lungs are always dormant, and there they develop infection, and that is why it is called pneumonia. And then pneumonia is one of the complications which causes death. So the fear of developing pneumonia in a long-standing non-ambulatory patient is there. The pain tolerance will be better, it will help good healing. Now pain tolerance, as yesterday I was talking to Dr. Maruti, is there any major which parameter by which we can measure the pain? We cannot measure the pain. If there is a pain, what will happen? If you ask the patient post-operative, when we go to the ward in the second day, we tell, okay, come on, you get up, now sit, you take your hand up. He says, oh, I am getting pain, what you are telling me, wait for some more days. So again he is in non-ambulatory condition. So if patient is not moving, the normal routine doesn't come up, and patient may have a delayed discharge, because he will have to stay in the hospital till the time he becomes up and above and start moving it. Convalescence period will be more if the pain perception is more. If pain perception is less, second day we have seen some patients, second day they sit and make movements and there is no problem. That patient, 7 day we remove the stitches, 8th day he goes home. And the patient who is more, pain tolerance is less, not ready to comply with us, whatever we tell him, okay, get up, sit down. This patient, they stay in the ward for 15-20 days. It is because non-ambulatory condition. So these are all problems faced by the patient. And what are the problems faced by the surgeon? Till the time patient is not discharged, surgeon has got a tension. I don't know what will happen. Suppose he still lie down in the bed all the time, say he may develop pneumonia, and whatever I have done, that will go to the waste. He will die because of pneumonia. So this tension is there to the surgeons. Now yoga as a therapy can be used as preventive, curative, adjuvant and palliative. Preventive, if you practice yoga, you can keep yourself healthy. So it acts as a prevention, which sages were doing in the hill area. They never used to fall sick because they are practicing yoga. Then curative. Curative is possible in cases early diagnosis, early onset diabetes, early onset hypertension, just diagnosed about 6 months back, 1 year back. Those patients, if they start practicing yoga, they can definitely get cured by that element. Adjuvant, suppose diabetes is there for last 10 years, hypertension is there for last 10 years. Such patient, if you do yoga practices, their doses can be controlled, their drug may come down. Suppose he is on 4 tablets a day, he may require 2 tablets a day. So there it acts as a adjuvant. And palliative. Now some patients, we have done everything, operated, but he is not cooperative, pain factor is there, he is not making movement, he is not taking any active movements to get up and sit. They are on the verge of dying, suppose. So whatever life remaining is there, let us make it comfortable by giving yoga practices, and that is the palliative. Now can you give the yoga practices in operative patient as palliative, curative, adjuvant? No, it is only adjuvant therapy. You cannot give the preventive, curative or palliative. But by giving yoga practices, adjuvant therapy, it can prevent the sense of yoga practices, will prevent the complications and will get a good post-operative period. Convalescence period will be less and it will not have the bad post-operative results. So that is how it acts as a preventive. Now coming to the, what are the effects of yoga as adjuvant in preoperative? By practicing yoga during preoperative period, what will happen? He will have good mental preparation, will face the surgery boldly, leading to good pre and post-operative period. Because again here the principle comes, the way you think, you become. If you are taken in the mind that yes, I am going to become all right, I am in a good hands, the surgeon is good, the hospital is good, very good reputation, and my 2 friends were operated for same reason and they have become all right. This faith is there, he will become definitely all right. But this can be infused by giving yoga practices in preoperative period. So you have to bring him up from that depressed mood. Then improving the strength of voluntary and involuntary muscles all over the body, particularly of heart, lungs and kidneys. By practicing yoga, giving him asanas, you will improve the flexibility of the muscle, the tone of the muscle. So it will, because muscles are there all over the body. You take any part of the body, there are muscles, even vessels, artery and vein. The wall is made up of vessel. So if the walls, muscles are functioning properly, the contraction, relaxation of the vein, artery will be good. So it improves the muscular functioning. Then it may have uneventful quick reversal from anesthesia. If the muscles are good, the liver, kidneys, they are functioning properly. When anesthetic drugs are given, they will be excreted out immediately and he will come out of anesthesia. So reversal will be good. Then convalescence may be short. Expected good results can be achieved and morbidity and mortality will be less. Morbidity means post-operative, after some event, if some after effects are remaining over there, that is called morbidity. And mortality means going up. So morbidity and mortality will be less. Then effects, how they act. Suppose patient is given preoperatively yoga practices. Suppose he has got diabetes, he has got blood pressure, it will come under control. So when anesthetist has to give drug, he has to think 10 times whether he has got diabetes, whether he has got hypertension, whether he is on some corticosteroid, so that again he has to think the drugs accordingly. So it will help to give proper anesthesia and the reversal will be better, and the removal or drugs which are given for this patient, they will be excreted by kidney, liver and lungs if they are functioning properly, and total treatment period may not be stormy. It can make post-operative life very much comfortable. So that is how effect of yoga as an adjunct in preoperative stage. Effect of yoga in intraoperative period. Cannot practice yoga in this period as he is unconscious. But whatever yoga practices perform in preoperative period will show the effects by uneventful smooth reversal from anesthesia. This is very important thing. Once patient is to be anesthetized, anesthetist has to see whether he has got diabetes, blood pressure, or is he on corticosteroids. So accordingly he has to adjust dose. Sometimes he might have to give more doses. So longer the anesthesia period, morbidity, mortality increases. Shorter the period, better the results. Another thing, I believe in that Almighty has given us this human body, and by operating, we are insulting the human body. When we are cutting it with a knife, we are insulting the human tissue. More the insult done, more the bad results. So shorter the period of surgery, better the results are there. That is what we have seen in last my 49 years of surgery. If I take more time for 15 minutes surgery, if I take 1 hour, usually I will get bad results, because more insult is done to the human tissue. Shorter the period, better the results. This is only possible when there are no or less or under well-controlled comorbidities before surgery. He will have speedy recovery in post-operative period. Now normally in our body there are thousands cells and muscles, and these muscles, they are of two types, voluntary and involuntary. Now when you sleep, do you think that your all muscles are sleeping? No. 10% of muscles are active, alert. So suppose you are sleeping and bell rings, suddenly you get up and start walking. How it is happening? Because 10% of the muscle which are active, alert, they start the action, and then remaining take up action, and then you are able to walk. Now such a patient, suppose you are sleeping also, if somebody comes and puts some hot object on your finger, what happens? Immediately you throw it away. That means some sensation is there, muscles are active. Now when want to operate, if patient is in that position, if I cut, what will happen? He will throw the hand up. So we want total paralyzed. Patient should be totally paralyzed. If I cut, he is not able to make movements at all. And for that, you have to give anesthesia, which will, all muscles are paralyzed. Patient is not breathing on his own. We are putting a tube through the nose, through the trachea, that is called endotracheal tube, and we are connecting to the respirator. Once operation is over, the anesthetist starts reversal of the anesthesia. What we will do, first we will stop giving the anesthetic drugs, which is maintaining his paralysis level, and then we are giving antidotes, so that the whatever drugs were given, they will be nullified and they will be excreted to the kidney. So some of the drugs are excreted through kidney, and the gases we use for anesthetizing patient, nitrous oxide and all that, they will be excreted by the lungs. So what is necessary? That he should have good liver, kidney functioning and lungs functioning. Then all these drugs will be excreted, and then patient will come out of anesthesia. Otherwise what will happen? If patient doesn't come out of anesthesia, if the alveoli, lungs are not functioning properly, nitrous oxide is not excreted, it will remain into the lungs, and patient will be having anesthetized effect. So operation is finished, but patient has not come out of anesthesia. So this is possible. So if he is on respirator, unless and until patient starts breathing on his own, we cannot take out the tube. So we have to wait for that. So if lung, kidneys and liver all are functioning properly, then it is possible to extubate, means remove the tube, and patient will start breathing on his own. This is possible if he has practiced yoga pre-operatively and all the conditions of the lung, liver has improved, then it is possible. Other muscles in the body functioning like lungs and cardiac muscles, excretion of the drug occurs to the kidney, liver, nitrous by the carbon dioxide from the lungs. Quick reversal immediately after completion of surgical procedure is only possible if muscular system, liver, kidneys and lungs are functioning properly. This is made possible by practicing yoga pre-operatively. So the skill of the anesthesia is also there. Always good surgeons get good anesthetists. the combination of bad surgeon and good anesthetist never stays. Because if surgeon is good, you will definitely get a good anesthetist. If surgeon is bad, if whatever good anesthetist is there, what is the criteria of good anesthetist? When I take my last suture and tie it, by that time patient is out and he will ask surgeon, my surgery is over? So that is a good anesthetist. If such anesthetist gives anesthesia to a bad surgeon, what will happen? He will get bored. So this time he has attended him, but next time suppose that surgeon calls the anesthetist, he will say, no, today I have got another case, I am busy, you can call another anesthetist. So this happens. So good anesthetist can prove his skill provided patient's general condition is good, liver function is proper, kidney function is proper, and this can be given by practicing preoperative yoga, and that is why the importance of it. Effect of yoga as adjunct in post-operative period. Now post-operative period is very cumbersome period. That time patient is bedridden, first few days he is not able to move, he is not given oral feed, so he is nil by mouth. Then because of the pain he is not making any movements. So because of that what will happen? Because of the associated co-morbidities also, patient will, the convalescence period will increase. Then he will be under tension. I have been operated 8 days back and still I am lying down, I am not recovering, I am not able to sit, my pain is not going, I am not given food also to eat. So all these problems will make him mentally upset. If he is lying down for a long time, again the chest complications, lung complications can occur. So when you can give practices, if he has practiced preoperatively yoga, then he can start practicing yoga after operation. But if he has practiced preoperatively, he knows the technique, he knows the benefits of yoga. You need not waste time in giving technique and giving him explanation. If you practice this, you will get this benefit. You need not. And in that post-operative period, he is not in a mood to listen all these things. He said, oh, what you are talking, I am getting pain. Don't talk all this nonsense. So, but if you have given him yoga practices preoperatively, he knows the importance, he knows the technique, he will practice it definitely. So, this is possible. 5 minutes. So it will save the time in giving him techniques. As patient knows the technique, he can practice it definitely. Now what yoga practices you can give? These are the different yoga practices you can give to the patient in preoperative period. Now what basic principle you have to remember? That the yoga practices should be selected as per the disease and part of the body affected. Avoid practices which has got direct effect on that affected part. Suppose he has got a lung disease, so you will have to avoid Kapalbhati. So it is decided by the therapist by looking at the patient's condition and what type of operation is to undergo. Now coming to the post-operative period, initially patient is nil by mouth, means he is not given anything orally. So that time what you can give? You have to wait for some more time. Once he start given oral feeds, once patient starts getting oral feeds, now he feels now I become normal. So then his mental setup is ready to do something which you tell, and then you can give him all these practices. Once the sutures are removed, after operation sutures are removed and he is fit for go home, the wound has healed, that time you can give these practices and you can add some more practices. The main important is Kriya Yoga and Kaivalyadhama tradition, meditation, which will help to bring him back to the normal. Here again precaution same. You will not give practices which are particularly affected part. Then it should not be given hurriedly, it should be step by step and should not use force in practicing yoga. Now just 2-3 minutes I will take the different kriyas. I have been giving scientific explanation of all yogic kriyas, what happen when you practice Kapalbhati, all that. So I will just give Kapalbhati. If you practice, there are about 13-14 benefits I explained. In that, the important is the patency of the tracheobuccal tree is maintained by practicing yoga. Alveoli are kept alert in view of elasticity, which is more important from the point of view of anesthesia. It cleans up whole of the respiratory system, increases lung capacity, which is very necessary prerequisite for the anesthetist patient. Then Ujjayi, it cleans up the air passage, increases the lung capacity. Besides, there are so many other benefits also, but only from operative point of view I am telling you. Then I have tested, now everybody knows the pulse oximeter. I have tested oxygen level in 300 patients after practicing Ujjayi, and here you can see the improvement into the oxygen level in pre and post yoga. Then Brahmari is one of the best thing because it improves, it kills the bacteria and virus in respiratory tract, so causes vasodilatation at alveolar bed, so no pulmonary hypertension. It has been proved the humming done because of the Brahmari, it increases the 15-fold increase in the nitrous oxide production. It happens into the paranasal sinuses. And these two definitely will kill the bacteria and virus into the respiratory tract. It has been very useful tool during the COVID period. Asanas, I will just say these are the muscles all over body, and in these muscles there are the arteriovenous arcade like this. And what is the importance of this? By practicing asana, again there are so many benefits. Important, improves the flexibility, prevents the rigidity of the body, increases the stamina and endurance, improves the artery and vein arcade functioning in the muscle, which increases flow and also helps to take out the waste product, the anesthetic drugs, they will be washed out immediately. It helps to drain the metabolites, so the muscle will improve. Shavasana, it improves the blood supply to the heart, particularly coronary arteries, and if 10 minutes Shavasana, blood more will flow to the heart and you will feel fresh. Then Kriya Yoga, Anulom Vilom Omkar Gayatri, it helps to improve the belief system, healing system starts functioning. What happens? It mobilizes the body resources in such a way that you get well, and that is important for a patient who is recovering from the surgery. Gayatri, the way you think you become, I already explained to that. Yoga helps to improve the immunity at local and systemic in general. It at cellular level, health improves the balance between the pro-inflammatory cytokines and anti-inflammatory cytokines. If the pro-inflammatory cytokines are more, patient will have more illness. But we have done research and we found that yoga has improved the level of the anti-inflammatory cytokines, which will help to keep the health. I would just like to give more importance of why yoga should be practiced. So this Kabir Surdas Doha I am going to tell you. He said, Re mana dhiraj kyau na dhare, Re mana dhiraj kyau na dhare, Savat 2000 ke baad aisa yoga pare. He said, have some patience, don't be panicky. But he said, after year 2000, a time is going to come. What type? The Purva, Paschima, Dakshina, Uttara, Chaudisa, Kala Pire. There will be increase in death toll. Everywhere on this side, there will be, you will find a death occurring. And the person who was listening to it, he got frightened. He said, if such thing happens, what will happen on the earth? The Kabir Surdas, who has written this, he was a blind person. But he knew what is going to happen after 400 years. What he said? काल व्याल से वहीं बचेगा जो सोहम का ध्यान करेगा. ये है हरि की लीला, टाले नहीं टले. He said, this is going to happen. But if you want to save yourself from that, you control your breath. And the science of controlling breath is nothing but the yogic science. And that is why you understand the importance of the yoga and start practicing and cultivate good habits. Once you get into any habit, you cannot get rid of it. See the fun of the word habit itself, H-A-B-I-T. Remove H, sit down 1 minute, I get more tension. I told you 5 minutes, I am finishing it. Remove H, a bit remains. Means still habit is there. Remove A, bit remains. Remove B, it remains. Means he still goes to the hiding place and smoke a cigarette. And do anything, habit remains. Means once you get into any habit, you cannot get rid of that. So try to cultivate good habits, and those good habits are nothing but yogic practices. So I pray Almighty, you will all practice yoga regularly and you will keep yourself healthy and also make other people also healthy. Thank you very much. These are my books. Thanks a lot. I Personally, I can give thanks to Dr. Bhavanani for giving me such an interesting topic, because I, being a surgeon, I am interested in giving yoga to the pre and post operative period. Thanks a lot. Thanks a lot, sir. Thank you very much. Hari Om.
Thank you so much, sir. You know, we always hear of so many topics. So I felt that it would be wonderful to hear from a surgeon about how, because people always say, even yesterday we all in our panel were saying, yoga cannot be used in emergencies, we cannot use it in operation theatre, you know, this is what we say. But then to know that there are places it can come in, I think it's so important. So thank you so much, sir, for your kind sharing.